Hi, today I'm joined by Dr. Sophie Shotter, and we're talking about a treatment that she's devised called the Ultimate Glow. Now, this treatment uses a product called Profhilo. Sophie, how do you incorporate Profhilo into the Ultimate Glow treatment?
So, my thinking behind it was, I love Profhilo on its own, but I used to get questions from people saying, what's the difference between Profhilo and skin boosters and, for example, Volite by Rejuvenate? And I think most of them are actually great products, and it really made me think that they shouldn't be an instead of, because they actually work in subtly different ways. So by combining Profhilo, which is in the purest set, it's there for 20 to 30 days, then it's gone, and it's stimulating your collagen production by your fibroblast cells. And then combining that with Volite, which is like a super soft skin filler, and I describe it as an injectable sponge. It sort of holds moisture there for 6 to 9 months.
So the two are working in tandem,
Exactly.
really?
Yeah, so I tend to do a Profhilo, then 2 weeks later a Volite, 2 weeks later another Profhilo, and I'm finding the results are really beautiful.
So then you're getting that overall effect of deep moisturisation in the skin, and a substance that's actually holding it in there a little bit longer as well.
Exactly.
Sorry about the and thinking about your sponge effect. So you're actually putting moisturisation into the skin, but also giving it a possibility of retaining it in certain areas for longer.
Absolutely, and the collagen stimulation and production that comes with both treatments, but a little bit more so with the Profhilo.
Okay, and who is this suitable for?
So anyone who wants to work on their collagen bank. It's a concept I think is a really interesting one. We all have a finite amount of collagen that starts to deplete from the age of 25 onwards, and so anyone who wants to rebuild that, this is a really, really great way of doing it.
Okay, so especially for, say, an older woman who's going through menopause, collagen levels have dropped,
moisture levels have dropped. It's a perfect treatment for that sort of age group.
Okay, sounds amazing. And how long are we talking about? So you've got 3 different treatments.
Yes. So you can have all 3 treatments across a 4-week period. Okay. So day 0 is your first Profhilo, 2 weeks later is your Volite, 2 weeks after that is a Profhilo again.
Okay. Any downtime?
Anything with a needle through the skin, there's a possibility of bruising, and you are a bit bumpy after the Profhilo. The Volite, the injections are smaller, but there's more of them.
Okay. So maybe a little bit of downtime, but very minimal. Okay. Sounds really good.
I also think there are other things we can combine it with. So one example is, I tell all of my patients who are having filler-based treatments or Profhilo to go home and drink lots of water for the next 48 hours. So one of the kind of add-on options I've done is to combine it with an IV at the same time.
Okay.
That's targeted at optimising your hydration at the time of injection, so we hopefully get the most out of the hyaluronic acid that's being injected. And then can also combine it with fillers to give a nice sculpt to the face. And fillers are actually surprisingly important for skin as well, because actually when we have the framework, it showcases the skin better. Okay. So that's one way I like to use filler. And then we can also use it in combination with Viscoderm Hydra Booster, which is actually also from the Profhilo family, to target fine lines and expression lines. So that's another little combination I've come up with.
So really what you will do is you will speak to a patient and you will go through exactly what they need for whatever areas in their face, and then tailor the treatment. So although Ultimate Glow is available for everybody, you will actually sit down and explain to someone exactly what they need.
Yeah. These are all bespoke treatments, and every face is different. So it's to make what are the possible add-ons. I think that combination of the Ultimate Glow works for everyone. But there might be add-on treatments that would be beneficial for the face in front of me.
It's quite exciting, isn't it, that we can stimulate our collagen again and our elastin and actually reboot our skin, basically, isn't it? It's like hitting the reboot switch.
Yeah, and there are so many treatments that claim to do that now, but I'm actually a big fan of doing it in different ways. So I think I love combining therapy, for example, with Profhilo, with the Ultimate Glow. I love combining Tixel, the Venus concept technology. So depending on the skin in front of me, I might actually suggest 3 different ways of switching back on your collagen production.
Okay. I think this is something that is so important that if you're thinking about these kind of treatments, that you actually see a doctor who is qualified to actually give this treatment and also really experienced in all these different formulations, different treatments, different methods of actually getting a really great look to your skin and great hydration. Sophie, thank you so much. It's really interesting. Of course, I could sit here all day and chat to you about this because I think it's a fascinating area of medicine. Thank you so much.